All right, we're going to jump down now to the facial bones. And I guess I would normally have thought that the frontal bone's kind of part of your face, it's your forehead, but it's not technically a facial bone. But this bone right here, it's not only right here, this front part of your face, but it's also the bone that holds your teeth, your upper teeth. This is called the maxilla. Maxilla. Some people consider it maxillary bones, but maxillary bones or maxilla. That's good for us. Um, that is actually at the top of page 53. Let's look at the roof of your mouth. Ah, here's the roof of your mouth. The roof of your mouth, see here are all of your upper teeth. Those, right? And this, right there, that's still maxilla. Technically, these are the palatine processes of the maxilla. Now, if I ran my finger back far enough, I would still have some bone there, but this back part of the hard part of the roof of my mouth is actually known as the palatine bones. And I remember that because the roof of your mouth is called your hard palate. Maybe not everyone knows that. But if someone is good at distinguishing flavors, then we will say they have a sophisticated palate. And we're talking about the roof of their mouth. All right. So the maxilla is here, here, here. And the roof of your mouth, the front part is the palatine processes of the maxilla. The back part is the palatine bones. Okay. Mandible, you already know. Mandibular condyle. Here. So here's the mandible. There's the mandibular condyle. You know that condyles are knobby joint things. So we have the occipital condyles on the occipital bone that form a joint with your atlas. And then right here, right in there, there's a little tiny disc that if it gets injured, it'll cause people to have a jaw that locks. So the mandibular condyle. All right, let's go back here to the nasal bones. The nasal bones are what I set my eyeglasses on most of the time. Nasal bone right here. The vomer, I already told you about. The vomer is this pink bone, and it's part of your nasal septum, the inferior part of the nasal septum. The zygomatic bones, we already know. They're basically your cheekbones, palatine bones, got it? Oh, okay, hyoid bone. The hyoid bone we're going to talk about again when we get to the respiratory system. Your hyoid bone sits right here, and if anyone ever bets you $100 that you can't name a bone that's not attached to other bones, you will say, yes, I can. It's the hyoid bone. The hyoid bone is the one bone in the human body that is not attached to any other bones. And it's right here. If you pay attention, you'll also hear the hyoid bone mentioned in procedural dramas. You know, those TV shows where they're always figuring out like how someone got killed just by looking at their skeleton, and they'll say evidence of strangulation because the hyoid bone was fractured. Now you'll know what that bone is. Great. All right, so we are going to move to the sutures. Now, when suture means to sew, right? And where the bones are sewed together are called the cranial sutures. Here is the coronal suture. The coronal suture is where the frontal bone meets the parietal bone. By the way, that could be an image question or it could be a word question. I might ask you, what is the name of the suture formed by the frontal bone and the parietal bones, right? Now, right down the middle between the two parietal bones, that is called the sagittal suture. Yeah, the sagittal suture, that's B. And then we've got the squamous suture, and the squamous suture is this one because it looks like the letter S. So where the parietal bone meets the temporal bone, squamous suture or squamous suture, I don't care how you pronounce it as long as you spell it right. And then we've got the lambdoidal suture. The lambdoidal suture, here's half of it. I don't think I have a great picture of it all together. No. So in the back of your head, the occipital bone kind of meets the palatine, the parietal bones in an upside down V-shaped. And that looks like the letter lambda in Greek, so they called it the lambdoid suture. All right. So now this is the top of a baby's skull, and this is not on the quiz or the midterm, but you know, babies have got a soft spot in their skull, and the biggest soft spot in their skull, yeah, there we go. The biggest soft spot in their skull is this one right here, and that one right there is formed by these frontal bones meeting these parietal bones. And when you're still a baby, those bones have not quite grown in. And as they grow in, the soft spot goes away. So that's what the fontanelles are, is where the different bones of the skull meet. Not on the quiz. Alrighty, let's move on to the vertebral column. And let's start with talking about the ribs and the sternum. You have got 12 ribs on each side of your rib cage. The ribs will articulate with, form joints with the vertebrae, your backbones, on the posterior aspect, and then they wrap around your lungs and your heart, and then they will form joints with your breastbone, which is properly called your sternum. Okay, this bone is called your sternum. The different parts of the bone, this upper part right here, is called the manubrium. The middle part, the biggest part, is just called the body of the sternum. And this lower part is called the xiphoid process. You may know someone who's got a xiphoid process that kind of sticks out forward, right? So make sure you know the sternum in general, and make sure you know the parts of the sternum. And you know I'm not going to ask you for the name of the body, right? It's going to either be manubrium or xiphoid process. And xiphoid starts with an X, not a Z. Sorry. By the way, if I ever ask, okay, name this part of this bone, it's nice if you say the manubrium of the sternum, but if you can only remember sternum, at least put that down. Maybe you'll get half a point, right? Now, let's talk about ribs. You have got different kinds of ribs. And here in AP 120, we consider the first 7 to be true ribs. We consider the next 3 to be false ribs. And we consider the last 2 to be floating ribs. Okay? I don't need you to learn the term vertebral-condyle ribs. Now, why are the first 7 considered true ribs? Because each one of these ribs has got their own piece of cartilage that connects that rib to the sternum. These guys, 8, 9, and 10, they're called false ribs because they've got a little piece of cartilage that attaches them only indirectly to the sternum. They're catching a ride on rib 7. And then these last 2 are called the floating ribs because they don't attach to the sternum at all. They're considered the floating ribs. All right. A little bit more about the back. Now, you don't need to know that much detail about the sternum. But when it comes to vertebrae, when it comes to the bones that make up our backbones, 7 of them are in our neck. And the neck region is called cervical. Cervical. Now, to some people, cervical reminds them of a woman's cervix, which is at the other end of the body. Don't let that get you confused. The neck is known as the cervix, and the cervical vertebrae are the 7 ones of our neck. Interestingly, we have got 7 bones in our neck, and a giraffe has got 7 bones in their neck too. They're just really, really long. Okay? We've got 12 ribs, and it's not a coincidence that we have 12 thoracic vertebrae because each backbone that has a rib attached to it is considered a thoracic vertebra. So 12 ribs, 12 thoracic vertebra. And then we have got 5 bones in our lower back. The chest cavity area is considered the thoracic region, and the lower back is considered the lumbar region. You may hear people say, oh, that office chair's got really good lumbar support, or I need a car seats with lumbar support. Okay, and that's because they want their lower back supported. So one way to remember this is like meal times: breakfast at 7, lunch at 12, dinner at 5. Okay, that's a little bit of an early dinner for at least for my husband's taste, but 7 cervical, 12 thoracic, 5 lumbar. All right. Okay, we are going to wrap up with the individual vertebrae in the final video.